Hello everyone, I am Dr. Aparna Govil Bhasker and I'm a bariatric and laparoscopic surgeon associated with hospitals in Mumbai, Navi Mumbai as well as Thane and Surat. And one of the common questions that people tend to ask me is about side effects after bariatric surgery. And there are a lot of myths about this, and people do feel that the surgery leads to too many side effects, etc. What happens after the surgery is that the oral intake of the patient goes down considerably. So in the first few days, or say the first 2 weeks or so, we need to be careful about the hydration level of the patient. So we must encourage them and guide them about taking adequate amount of liquids and even the food intake as well. So hydration level has to be maintained. That is number one. Second thing is that after the surgery, a lot of patients will feel a little bit of a choking sensation when they eat food, because after any kind of bariatric surgery, the size of the stomach becomes much smaller, and people have to be counseled about the new stomach as well as the new way of eating food, because if they try to eat too fast or if they try to eat too much at one go, then there is a tendency that this food may get choked up, and they may feel like throwing up if they don't stop when their body tells them to. So that is another thing which is usually experienced by the patients in the first 3 months or so, which is also the adjustment phase. In about 3 months, patients are able to judge about how much they will be able to take, and things become better and better. The intake also goes up gradually, and they are able to eat much better after that. Now, the other things which patient experience after surgery is during the period of acute weight loss, when they're losing massive amounts of weight, they also experience some degree of hair fall. This is where the importance of protein supplementation as well as iron supplementation comes into the picture. And if there are deficiencies of protein and iron, this hair fall will be even more. So yes, definitely if you lose weight by any technique, you are bound to lose some degree of hair, but if your protein intake and iron levels are normal, then this hair fall can be under limits. Now, the other thing that can happen after bariatric surgery in the long term is deficiencies. So your bariatric surgeon would normally advise you nutritional supplementation after bariatric surgery, and that must be followed very strictly. Investigations must be done at regular intervals as guided by your surgeon, and supplementation must be taken as per their instructions. In case the patient stops taking supplements, nutritional supplements in the form of iron, multivitamin, calcium, protein, B12, D3, then there are chances that these deficiencies can develop, and the symptoms of these deficiencies can then start manifesting. So it is very important to maintain a follow-up with your bariatric team after the surgery. The other things could be that sometimes after certain surgeries there could be an increase in acidity levels, which again, if you are feeling any of those things, then you must get in touch with your surgeon immediately. So if there are any signs or symptoms which you feel are out of ordinary and you feel that this is not right, then I suggest that you must go back and see your surgeon at the earliest and not neglect your symptoms at all after surgery, because all of these are actually preventable, and if they are treated at the right time, then they are completely treatable and curable. Thank you.